So we just finished up the first region of our lower limb. That was the femoral region or the thigh. The bone pertaining to the femoral region is the femur. So let's answer another question for submission. When siding or determining left versus right for a femur, what marking must face medially? What is going to be your medial marker? All right. So moving down to the leg or the crural region of the body, we have the tibia and the fibula. The tibia is going to be the medial bone of the leg, and the fibula is going to be the lateral bone of the leg. The tibia is the only one of the two that actually articulates with the femur. Where it articulates with the femur are at lateral and medial condyles. So these larger portions up here at the proximal end of the tibia. How are we supposed to determine, though, lateral versus medial for those bones? Look down at the proximal end of the tibia. We have this marking called the medial malleolus. It is this kind of overhanging growth of bone projection that is on the medial side. So you see that medial malleolus, that's your medial marker. Follow it up, this has to be the medial condyle, making that the lateral condyle. Okay, so those lateral and medial condyles of the tibia are going to articulate with the lateral and medial condyles of the femur. Okay, now because the fibula doesn't articulate with the femur, it's really only articulating with the tibia and then ankle, the bones of the ankle. So the fibula has nothing to do with the knee. The knee is only made out of the femur, the tibia, and the patella. The fibula's job is really just to stabilize the tibia. Okay? So let's talk about some more markings. On the anterior side of the tibia, we have the tibial tuberosity, which is just kind of a very large rough patch, a very large tubercle on the bone. It is closer to the proximal ends of the bone, so we can just kind of feel around for that and identify the anterior, because on the posterior side, it doesn't have that rough marking. Tibial tuberosity comes up a lot with muscle attachments, but also we can just remember that this is where the patellar tendon attaches to and stabilizes the knee joint, okay? Or well, assists in stabilizing the knee joint. Okay, so that medial malleolus of the tibia should always be facing medially on the body. The tibia itself is a medial bone compared to the fibula, but the medial malleolus also needs to be medial. Let's talk about the fibula. So the fibula also has a lateral malleolus. It also has a malleolus, I mean to say, but on this case, we call it the lateral malleolus because it is lateral. It is essentially just the distal end of the fibula. That's just kind of what we refer to as the lateral malleolus. But it is lateral because fibula is the lateral bone. All right. At the top, at the proximal side of the fibula, we have the head. Okay. The head is more spherical than the lateral malleolus. Okay. There's also a fossa at the very edge, like the medial portion of the lateral malleolus has a fossa on it, so a small depression, And so if you feel around for that, you'll be able to really, okay, yeah, this is more narrow and it has this fossa. So now I know for sure that this is the lateral malleolus, whereas the head is more spherical. And you can kind of see that. Okay. So as long as the lateral malleolus is facing laterally and the medial malleolus is facing medially and the tibial tuberosity is facing anterior, that's kind of how we can identify left versus right with the tibia and the fibula. If you were looking at a disarticulated fibula, I would not ask you for left or right because it's really hard, because when you think about it, it's just kind of like a stick. No, just kidding. It's a very important bone. Yeah. No, it looks like a stick. So it is harder to identify left versus right, but a disarticulated tibia, you should be able to do left versus right by looking at that medial marker and the tibial tuberosity on the anterior view. Okay. Now, both of these bones articulate distally with the talus, which is a tarsal bone. All right. Before we dive into a tarsal bone, no, never mind. Change my mind. Okay. Let's dive into a tarsal bone. Okay. So a tarsal bone. We are now going into the ankle anatomical region. Okay. So the ankle is going to be made out of the bones fibula, tibia, and talus. Talus is one of the 7 tarsal bones. So these are the bones of the feet, sort of like the carpal bones, which were the bones of the wrist. Okay. Big difference though. There were 8 carpal bones and there are only 7 tarsal bones. Cool thing, you only need to know 2 of the tarsal bones, whereas you need to know all 8 carpal bones. So talus is a bone that's going to sit superior to the other bones, and it has kind of a rounded surface so that the tibia and the fibula can articulate really nicely. And so those 3 bones are going to make the ankle. All right. But then if we're just looking at the foot, which we refer to as the pedal region, right? The foot itself is made out of the tarsals, metatarsals, and phalanges. Now, the naming of metatarsals is just like it was with the metacarpals. We just have to make sure that we're saying the right term. Metatarsals are in the foot, metacarpals are in the hands. Okay, so your big toe, right, is going to be digit 1. So it would be metacarpal 1. I'm sorry, metatarsal. I just did it myself. Okay, metatarsal 1, metatarsal 2, metatarsal 3, 4, and 5. Easy. Done. All right. This is a common location for sesamoid bones, again, because there's a lot of friction and tension here. So sesamoid bones, those little seed bones, could form along the metatarsals. All right. Naming of the phalanges, naming of your toes, right? Same thing. It's hard to think of because sometimes they're so small. But for digits 2 through 5, there are 3 regions: proximal, middle, and distal. Proximal, middle, and distal. Proximal, middle, and distal. Proximal, middle, and distal, right? And so we would name it as such. Middle phalanx 2, proximal phalanx 4, right? And we would be able to identify those parts of the phalanges, just like we were doing in the fingers. Now, if we remember, the thumb has a different term. Okay, the thumb has a different term. It was called the pollex. So I want you to write down and submit to me, why did we call the thumb a special term? Why isn't it just a normal phalanx? What makes it different? Okay. Now, the great toe or your big toe is going to be the same thing, all right? Except instead of calling it a pollex, we call it a hallux. So a hallux is referring to the great toe because, again, it only has proximal and distal regions. All right. So we talked about the talus being one of the tarsals, right? And it's also in part of the ankle. So really important tarsal bone. But the other tarsal bone that you're responsible for identifying and understanding is calcaneus. Now, the calcaneus is the longest and the strongest tarsal bone. Because talus is part of the ankle, talus, when walking, will actually transmit about half of your body weight onto the calcaneus. And then the rest of the body weight, the other half, will be distributed throughout the rest of the foot. So the calcaneus is really important as well as the talus. And those are the only two tarsal bones of the foot that you would need to know and identify. Okay. You do not need to know about the other 5 tarsal bones. All right. I think that is it for the appendicular skeleton.